Good morning. Happy Wednesday. Welcome to Melissa Chambers Consulting Wednesday Words of Wisdom. This morning, the title of what we're talking about is, okay, so maybe I am a little worried. Now what do I do? And I'm going to explain what we're talking about in a minute, but first and foremost, I would like to just take a quick second to ask anyone who's watching to please keep all of our Florida and all of our other southern states that may potentially be affected by the hurricane in your thoughts and prayers. And just really praying so hard that they all stay safe and are okay. I know they were already impacted so much by this first hurricane, and my thoughts and prayers have already been with everyone, and now, even more so. So I just wanted to take a second to say that. So a few weeks ago, there were a lot of questions about, the differences between normal aging and how do you know if how do you know the difference if you're just aging normally or if you might, possibly have some early signs of dementia. And so I did a brief little class on that. And if you didn't get to see it or watch it, please, it just was a couple weeks ago, so please go take a look. But after watching that, if you feel like, okay, maybe I am a little worried now, maybe this is a little bit more than just normal aging, what can I do? Or even if you feel like it is just normal aging, these are still good things to do. These are good things for any of us to do, especially if we're over the age of 65, but for any of us to do, period. So a couple things, 3 things specifically. The first thing is, I can't say how imperative it is to go to the doctor and get checked. Go to the doctor. Go to melissachambersconsulting.com under the resource tab. Scroll down a little tiny bit under the Facebook information, and there's a form there that says that if you're concerned about yourself or a loved one, click on it, print it out, check mark what you're concerned about, or say, here were the things that I was concerned about. I think it's normal aging, but I just wanted you to check. Or here are these things that I checked that I am concerned about. Can you please run some tests, do some screenings, whatever, to see if I do have dementia of some sort. But get checked. I cannot tell you how important it is. The doctor will do blood work. The doctor will do a more thorough exam. The doctor, may order some imaging. But I can't tell you how important it is to get checked because so many of us are affected by so many things. And again, I sound like a broken record, but it could be something that's reversible. For instance, your thyroid is out of whack. Maybe you have some vitamin deficiencies. Maybe you have depression. And so you treat those things and then the signs of dementia go away. Or the symptoms of dementia go away. So please, I can't say how important it is to get checked. And if it isn't reversible, that's okay too. It's important to be diagnosed early, to get treatment early, and to have conversations with your family early and sort of get things lined up and get on this journey, which we can make a little more positive by learning and getting some education. Okay. The second thing to do is get active. Now, I know sometimes, even when we're under the age of 65, let alone if we're over the age of 65, sometimes we say, it's kind of hard to get active. Now, some of us, we're doing great. Others, it's a little bit hard to get active. I have, this or that wrong. Excuse me. Sorry, my allergies are Driving me crazy. So we might say, well, I have this wrong physically or that wrong physically, and it's really hard to get active. Listen, we can get active even if we're in a wheelchair. Doing whatever we can to get active is better. It's proven. Research shows it's proven to be better than nothing. So even if we are in a wheelchair, or even if we are physically, stuck in a chair, I don't mean physically stuck, but I mean physically in so much pain that we just feel like we always have to sit down or be in a chair and we couldn't stand up to do exercise or something. It's okay. Even if you're in a chair and you're doing exercises, whatever you can do is so much better for you than nothing. So Google it, look it up. Consider going to physical therapy or getting some exercises like that. Consider going to Silver Sneakers, or getting involved with some chair exercises, or chair yoga or chair aerobics, or just, there's so many things that we can do nowadays. Even if you're in a stationary on a stationary bicycle, there's so many things that we can do. There are so many options, but trust me, it is better to be active even in a chair, even from a seated position, than to not be active at all. Now, if we couple that with doing it with a friend, getting involved in some sort of class, swimming, going to take a walk, whatever the case may be, and doing it with a friend, kills two birds with one stone. One of the things is that physical exercise, which makes everything better, not only just, potential dementia, makes everything a little bit better, including our physical pain. But number two, socialization is so, so, so important. And so if we can take care of the physical exercise and socialization, we're killing very two important things at once, and that makes it even better. So that's number one. Number two, which is also so very important, we say brain exercises or keeping the brain active, and a lot of times people say, well, I do crossword puzzles every day. Well, that's not necessarily what we mean. What we mean is doing something with our brain that it's not used to doing. So for instance, if you do crossword puzzles every day, it's great, by the way. It's great that you do that. You should continue doing that, especially if it's something you enjoy. But our brain is used to doing crossword puzzles every day. So try, and I never say it correctly, but like that Sudoku, the math puzzles, or try a different type of puzzle to do, because that means that the brain has to switch things up and do something that it's not used to doing. But even better, let's say let's say you're an engineer, or you worked as an engineer your whole life, and you don't really know a whole lot about the medical field. Try to look for classes, like even diabetic education, or just something totally, like if it has nothing to do with you, nothing to do what you normally know about or are used to hearing, better. That's the better yet. So try to take some classes that just can help you learn something new. If you were in the medical field your whole entire life, try to take a class on, something about history, or I don't know, just something that is not the same as what you're used to or what you've done your whole entire life. Learning, getting new information in the brain, making the brain think a different way, is so great. If you're right-handed, try doing something with your left hand every day, multiple times a day. Just something different with the brain. But taking a class with a friend that is about something that you know nothing about is wonderful. So that's what we mean by keeping our brain active. So those are the three things: going to the doctor to get checked, becoming physically active, and keeping our brain active. And doing those things with a friend makes it all even better. Now, I have to ask you for a favor. Please leave some notes in the comments of some things that you do. Give us ideas of some things that you do to keep yourself active. Just even regardless, having nothing to do with dementia, but just if you're over the age of 65, what do you do to keep yourself active? Whether it's socially active, with friends, whether it's being physically active as far as exercise or learning new things or anything like that. What are some things that you do? Because we all could use new ideas. So please drop a comment in the comment section and let us know something that you do or an idea that you have. If you need anything, I'm here, melissachambersconsulting.com. All of our contact information is up top of this page. Please don't hesitate to contact us if you need anything. Thanks. Again, prayers with all of our friends who may be dealing with this hurricane. And have a good week, and we'll see you next week. Bye.